And so we ended with a beautiful new poem, and I'm going to read you a poem from circa 1895. It's called A Fence or an Ambulance. 'Twas a dangerous cliff, as they freely confessed, though to walk near its crest was so pleasant, but over its terrible edge there had slipped a duke and full many a peasant. So the people said something would have to be done, but their projects did not at all tally. Some said, put up a fence round the edge of the cliff, some an ambulance down in the valley. But the cry for the ambulance carried the day, for it spread through the neighboring city. A fence may be useful or not, it is true, but each heart became full of pity for those who slipped over the dangerous cliff. And the dwellers in highway and alley gave pounds and pence, not to put up a fence, but an ambulance down in the valley. For the cliff, it is all right if you're careful, they said, and if folks even slip and are dropping, it isn't the slipping that hurts them so much as the shock down below when they're stopping. So day after day, as these mishaps occurred, quick forth would those rescuers sally to pick up the victims who fell off the cliff with their ambulances down in the valley. Then an old sage remarked, "It's a marvel to me that people give far more attention to repairing results than to stopping the cause, when they'd much better aim at prevention. Let us stop at its source all this mischief," he cried. "Come, neighbors and friends, let us rally. If the cliff we will fence, we might almost dispense with the ambulance down in the valley." So I did not write that. But as Catherine Hayhoe, the famous climate scientist, communicator, has said, we cannot adapt our way out of the climate crisis. And we absolutely are, we are committed to some warming and some dangerous weather, and we absolutely need to build better resilience and adaptation. It's extremely important. But at the same time, we need to be looking at the root cause, and in the last presentation, talking about getting to the root of the problem. And that's where I want to focus on the health benefit of climate action. This study came out last Wednesday out of the British Medical Journal. It said we've got the air pollution estimates wrong. The new adjustment is that ambient air pollution kills over 8 million people. 60% of that is from fossil fuel burning. So air pollution directly linked to burning oil, gas, and coal kills 5.1 million people every year. So this is a key message that we collaborated with many of you in the room, led by Nova Tebi, to submit to the global Stocktake to say, you know, your nationally determined commitments to reduce emissions have health and equity benefits, and put this health and equity benefits, put those numbers into your calculus when you think about what to do. And we think that driving the health benefits message will drive decisions faster, and we'll go further. So I'll just mention 3 things and hand it over to Nova. Unbelievable opportunities here in the energy sector because of so many people dying from air pollution. The food sector, if we all you followed the Universal Healthy Reference Diet, this is out of the Lancet Commission report, that 11 million premature deaths would be the benefit if we got to a more plant-based diet. And finally, we need to be designing cities for people, not just for private motorized vehicles, because sedentary lifestyle is killing about 4 million people every year. If you add up those millions, That's almost half of premature deaths every year. Climate action is the biggest health opportunity of our lifetime. And so this idea of mitigation, climate mitigation, is health intervention is incredible. Nova's going to dive into transportation. I'll just quickly mention the obvious. If you live in a city that's more bikeable and more walkable, you have less chronic disease, less obesity, diabetes. We all know exercise is amazing in reducing heart disease, cancer, dementia, and depression, because contracting muscles don't just burn calories. Contracting muscles are chemical factories for anti-cancer, anti-cardiovascular disease chemicals. So incredible. And also how we design our cities, green space, to reduce the urban heat island effect, but also green space reduces the risk of depression and anxiety. And this study in the proceedings of the National Academy of Sciences showed that if you're a child growing up in Denmark, no matter if you came from the capital or a rural environment in the countryside, no matter where you grew up, the risk of ever developing any psychiatric disorder was inversely related to your exposure to green space. So more green space means less mental health problems. So this is a report that actually Nova began this a couple of years ago. We handed this off to John Kerry for the negotiations in 1921 for the U.S. Nationally determined commitments to bring in health and equity issues. And then, so this is what we've been presenting here, and Nova has been in the negotiations. So this is looking at real world policies across energy, food systems, and transportation, and how they have health and equity benefits that negotiators here need to recognize the incredible health messaging there. Okay, so Nova, over to you.
Thanks, Jonathan. Yeah, so I've been working on this for quite a while, obviously, but I love doing it. So all of this work has culminated into our global Stocktake submission, which we wanted to emphasize the ambition, accountability, and acceleration. And that's what I'm going to present to you, is basically what is in our global Stocktake submission. So it's titled Maximizing Health and Equity Gains of Mitigation Policies to Deliver the Paris Agreement. And we had three major overarching aims with this submission in mind. One is we wanted to identify mitigation policies in various sectors, and I'll show the sectors in the next slide, that can also offer potentially substantial health and equity co-benefits. We wanted to make the case to integrate these policies in the next round of nationally determined contributions, no matter what country is. And third, we wanted to show, and this is really the most important part, we wanted to show that it's realistic to be ambitious on mitigation policies while also being ambitious to improve health and equity. And we do that with explaining what these policies are, but then finding real world examples of where it's actually being implemented, particularly on the local level. So our whole argument is, it's already being done, let's just scale it up. Easy peasy, right? So our main sectors that we focused on in the whole global Stocktake is a lot. Energy, industry, food ag, built environment, transportation, waste, land use and land use change, forestry, and healthcare sector. And I'd encourage you to read the whole submission if you really want to know all of that. But I want to focus on transportation in particular, and one specific policy within that. And that's called complete streets. And I'm not sure how many people know what complete streets are, but essentially it is an urban design plan which will enable spaces on streets for various stakeholders. So not just cars. So we're talking space for people, so including crosswalks and curb extensions. Is that me? Okay. That also includes spaces for bikes. And thank you. Spaces for bikes, so connected routes, low stress. And that includes bikes, e-bikes, scooters, obviously some space for cars, sometimes can't get around that, space for mass transit, space for shared mobility, and then space for creature comfort. And that includes a lot of green spaces. So if we can create streets that look like this, and even streets that maybe get rid of the space for cars in its entirety, then we're on the right track. And that's what the idea of complete streets is. And this policy in particular, and Jonathan kind of went into the majority of the actual health benefits of what we see, we can see health benefits of improved respiratory and cardiovascular health from reduced air pollution because we're using less cars on the road. We're going to enhance community development with more walking around. You get to meet more people as you go to your various things throughout the day. You reduce injury and accidents because you're removing cars from the road. You're focusing on pedestrians and cyclists. And then you encourage physical activity as well. The equity benefit here, and these benefits obviously are not exhaustive, but some of these equity benefits, we improve access to public transit. We give a cheap mode of transportation for low-income communities for essential resources like going to your job. And then we also create accessible pathways with some of the curb extensions, etc. And then the most important here is climate benefit. So this policy hits all three. So you reduce the need for a personal vehicle, you're reducing vehicular emissions. And the extra green space can also help reduce the urban heat island effect as well. So I want to showcase where complete streets have actually happened in the real world locally. The first one is the Smart Cities mission in India, which was created in 2015. And the main objective is to drive economic growth and improve the quality of life. And there's several other factors in this mission. But one of the aims was to reduce congestion, ensure security, reduce air pollution, and promote interaction in the local economy. And that included building new pedestrian walkways for walkers and cyclists to reduce accidents. And this mission has been pretty successful in seeing a lot of cities try to implement a complete streets idea. The next one comes from South Korea, and this one is particularly interesting to me. They removed a freeway, an entire freeway, in downtown Seoul, and they restored part of a historic creek that the highway went through. So they created an artificial creek that now flows through the center city, and they included green corridors around the waterway. And you can see in the picture on the right here, just a massive highway that's no longer there anymore, which is really great to see. And they found too that this actually handles flooding rains much, much better than a highway ever did. And it brought down the average summer temperature in the city. So this is a great example, and great pictures as well. And finally, the last example I just want to show is the Model Communities Program in New Zealand. And so in 2009, the New Zealand Transport Agency wanted to invest specifically in 2 walking and cycling model communities to encourage and enable people to reduce car use and try active transport. And so the 2 cities that they found that they invested heavily in was New Plymouth and Hastings. And within these 2 cities, and this is just a snapshot of all that they did, but they upgraded existing paths and added new cycle lanes. They provided practical and direct commuting routes for workers, students, shoppers, and others throughout the whole city. This picture on the left just shows all of the plans. And so this is a great example of what can happen on the local level. And all 3 examples, like I said, are happening now. They're happening all over the world. And that's really what we wanted to showcase in our submission, that we can have policies that can maximize health, maximize equity, help the climate, and believe it or not, they're already happening on the local level. We can scale it up, and that was most of our submission. So with that, thanks so much. Appreciate being here.
Hello, I am Marwa Bshara. I am from Chad. Chad is located in Africa for the ones who don't know. Okay, Chad is a developing country that's suffering from poverty. Chad has many endemic diseases over there, like malaria, typhoid, vector-borne disease, waterborne disease, diarrheal disease, and etc. So I am studying medicine right now in Sudan, but because of the conflict over there, I couldn't resume my studies. Malaria in Chad is mainly it's an increased number in autumn. In winter, in summer, not that much. So mainly people in winter. I mean in autumn have to sleep under mosquito net so they don't get bite by the mosquitoes and won't get malaria. But in the last couple years, we noticed that the time of the mosquito breeding and malaria and etc. is extending and becoming even more because we are suffering from even more extended, more hotter summers. We are having warmer winters, so the whole year we're having malaria. This climate change is affecting, but in Chad, people don't really actually think that that could be the key, reason. I am a climate change activist over there. I came as a youth to show the people how we're suffering from it. And I have been doing some researches about a new technique called SIT, sterile insect technology, that aims in reducing the number of mosquitoes. So I wanted to make more researches about it. I wanted to increase my capacity building in order to know how to work this technique and to know how would it be eco-friendly. So also my question is, this SIT technique, that sterile insect technique, is it really eco-friendly? And because I don't want to vanish a whole species in order to do that without affecting the ecosystem.
Yeah, thank you for that. And I'll just say, I don't know the specifics of that pesticide, but the point, it's absolutely critical that we recognize all of these many pathways through which climate affects our health. It's not just heat waves, it's not just floods, it's affecting biological systems like mosquito-borne diseases. It's a huge issue. And when we think about, we want to make sure that the treatment is not worse than the disease, so that whatever the intervention is, we need to go in with a full knowledge of the implications of that intervention so we don't make a problem worse. So it takes real integration across adaptation, resilience, with eyes wide open, and to know the potential side effects, unintended consequences, while at the same time, our big message is mostly to really think about climate action is a huge health benefit, a huge health dividend when we think about climate policy. So we need the multi-pronged approach, adaptation, resilience, and mitigation health benefits. And I have to go meet with US senators, so I'm going to bolt. Thank you.
Let's give them another round of applause.